Hello, and welcome to the We Talk Health podcast, the official podcast of West Tennessee Healthcare. I'm your host, Kara Mobley, and on today's episode, we are talking about men's mental health. And here in my studio, we got a full studio in here today. I've got three guests. I've got Jonathan Young. He is a Recovery Navigator Coordinator. Stephen Taylor. He is a Program Manager for Pathways Mobile Crisis in 988. And Troy Beasley. He is also a Recovery Navigator. Welcome to the podcast, fellas.
Thank you for having us.
Now, is this everyone here's first time doing a podcast?
My second time.
Okay. It's so glamorous.
Yeah.
We're hoping to do a video someday, but for right now, we're just doing audio. So Stephen, tell us, what was your last time here? Tell us a little bit about yourself.
Last time I was here, I was doing this podcast with Will Casagrove.
Yeah.
And it was on the storm disaster grants we get at Pathways to help people after, devastating natural disasters, make sure people are aware that we have mental health out there for you, and we'll try to help you in any avenue we can.
All right, yeah. So, Jonathan, tell us a little bit about yourself, about your role, how long you've been here.
Yeah, so Jonathan, I am the coordinator for the Recovery Navigators. What we do for West Tennessee Healthcare is meet people in emergent situations. Mm-hmm. We cover all the West Tennessee Healthcares. It's 8 emergency departments. I believe it's 4 hospitals total.
Okay.
So anytime that somebody comes in with substance use disorder, alcohol use disorder, anything of that nature, we go and meet them exactly where they are, offer resources, try to get them connected with a higher level of care if that's what's needed, just being a supportive shoulder,
right, yeah.
And just offer empathy,
right,
and support.
Support, yeah, that's what we all need.
Absolutely.
And Troy, give us a little bit of info about you. How long have you been here and your role here?
I started with the Recovery Navigator Department in May of last year, so just over a year. I've now transitioned to Dyersburg, so I've got Dyersburg and Martin that I'm mainly focusing on. So
sure, yeah. So June, we're filming this in June for Men's Health Month, but we don't just want this to be for June. We want this, information to be out there for all time. So in terms of men's mental health, anyone can take this. I don't know, Stephen, if you want to start. What are you noticing about, what the stigma or kind of what the sentiment is around men's mental health?
Well, I'm pretty sure I speak for most men in this region of the state. I was raised in a small town, and, there's always that, hey, rub dirt on it and then get up.
Walk it off.
Especially if you're a dude, stand up straight, be strong and all that. But, I've just had to recently change my definition of strength because strength is just not what you can carry. It's realizing, hey, when you need help too.
Right.
And, I feel like men are very hesitant to ask for that help.
Right. Because I guess what the sentiment around it is, maybe feelings of being weak. So what would you tell someone who's maybe, I don't know, if you've worked with anyone, that you've got any stories or anything of when they made that decision and, kind of what led them there?
Well, for my work now, I'm the program manager of the crisis team. So we serve 8 counties, and crisis is not, it doesn't discriminate when it comes, and everybody goes through a crisis sometime or another. So my team, when we meet with people, we try to build that rapport first, make a connection, and then we'll get into, hey, what do you need from us? How can we help you?
Right. And I feel like the way I grew up was, a man's not supposed to cry, a man's not supposed to have feelings, or if he does have feelings, generally the one that gets let out is anger. So what would you tell someone if they're struggling with that to try to change the narrative around that?
Well, first off, you got to realize, hey, men are human.
Right.
And with being human, there comes all those different emotions. And, sometimes even some emotions, men even feel those harder than other people. So, if you find yourself in that situation, hey, we're here to help. We added that 988 line. It's a totally anonymous mental health hotline, and anybody can call it at any time.
That's what, so you dial 988, or you can text it, I think?
Yeah, there are texts across the state now, but we don't have text at Pathways.
Okay,
but,
so you would just call that number.
And you can have a however long conversation about whatever you want.
Right, yeah. So, it is there for you. You can talk.
It's a sign that, hey, you're real.
Yeah, you are, yeah. And that, like you said at the top, that's strength.
Yeah, that is strength.
Reaching out. So, Jonathan, as the Recovery Navigator Coordinator, I've heard the term navigator in my 2 years here in a healthcare system. What is a navigator?
Yeah, so a navigator is somebody that with at least 2 years of sobriety or mental health recovery. Usually, typically, all of us that work in the office, we have been down that road, whether it be mental health or substance use disorder. But a recovery navigator is somebody that's certified, CPRS, certified peer recovery specialist. Like I said, it's 2 years of recovery. You go through a 40-hour class. And we just meet those just like us, I mean, just like Stephen was saying, we are human, and sometimes to better serve those that are going through a struggle, it takes somebody that's also been through a similar struggle to meet them exactly where they are. And that's what we do.
Yeah, and it helps to have a non-judgmental space to even say, there's no judgment here.
Right. Yeah. I always like to tell people I don't know exactly what you're going through, but I have a good idea.
Yeah.
I have a baseline of similar struggle, and if you allow me, after this conversation, if you allow me, I will walk with it as far as you allow. I'm here to help you in any avenue possible.
Great. Yeah. So, for all three of you, kind of what led you into these roles? What was kind of was there a catalyst or was there a life event or how did your journeys lead you to these roles?
So for me, it's kind of funny. My background was always sales or entertainment. Okay. I was an announcer for WWE, the wrestling company.
Oh, nice.
And actually, I had like a white light experience in treatment where, before when I was doing those things, I always wanted to help people. Mm-hmm. But back then it looked to me like at-risk youth or something like that. But while I was in treatment, I was like, man, I really wish I could have used that platform that I had then to help people. But now, I can use my experience and to piggyback off what Jonathan said, like, we meet people where they are and let them know, like, we've been exactly where you are. I've been in a hospital bed just like you have with the ventilator in my throat, not expected to make it. Like, so talk about building rapport that immediately puts that trust factor there.
Right.
Speaking for myself, I was always raised around the helping profession. My grandfather, he was a pastor all my life, and my mother's a teacher. And my dad in the community was kind of one of those go-to guys for everything. Oh, yeah. If you had a problem, you pretty much called him. But Stephen had other plans, and I give all the credit to God for me being in the position I'm in because I didn't plan on being here. I did not make this plan. But it sort of all accumulated into me being here and being able to help people in the immediate,
Right. So, Jonathan, what's your story? How'd you get to this role?
I've always wanted to help people myself. Whenever I was younger, I started pursuing social work right out of high school. I really wanted to help autistic young adults. Okay. Started struggling with self-identity, self-worth. I really didn't have a good sounding board, I guess, if you will, to express my feelings if I even recognized them for what they were at the time. Started doing a lot of self-sabotage. I went to what was easy, and that was drugs and alcohol. It was a pseudo feel-good. Yeah. It was just all fake.
In the moment,
But it worked, in the moment. But it drew me a lot further from Jonathan, Right. So after I was able to gather my thoughts and my life back, I pursued still wanting to help people. And, I give all credit to God as well that, this is exactly, I had to go through all that stuff in order to help others,
Right. Yeah. And I mean, having those resources and finding yourself, and even Stephen, like you said, with your dad being someone that people came to, I mean, I'm assuming that your dad also had issues that it's like he understood that he needs to be there for others. So it's all these mental things of like, I got to help others, or, you sometimes like you walk into something not knowing, where this path is going to lead. But, Jonathan, kind of like you said, there's time to turn it around. Like you don't have to keep going down that path.
Right.
So do you guys deal with inpatient, outpatient, both?
Well,
how do people come to you guys?
So mobile crisis, we cover 8 counties in West Tennessee. And we can get called out to residents. We can get called out to hospitals, jails. And we meet people that are in that crisis.
Okay.
And generally we would talk to them. And Pathways itself over here on Summer does have an inpatient.
Okay.
You know, after we talk to someone in crisis, we would then talk to them about the best form of treatment. What would that look like for them, whether it be outpatient, inpatient, or, what do you need, kind of.
Yeah.
And a lot of times I call John over here, and we kind of tag team a lot of cases.
Right, yeah, because you're talking about crises. So they're just like, spur of the moment, you're kind of just ready to go.
Yeah, and we're on call.
Right.
People don't realize that crisis is a 24/7 operation. So
Right.
Day, night, holiday.
Exactly, right. So who are you getting phone calls from? Like, is it generally the people themselves, or is it, loved ones, family members?
It can be a mix of everything. A lot of times we have concerned family members who call, what do I do in this situation? And we try to be that support for them as well. Sometimes we get calls, like I said, from hospitals. It's from, nurses and providers. Hey, I think this person needs to consult with somebody. And so we will do that.
Now, you all have slightly different job titles. Do you all go out in the field and work with people, or any of you,
it's
people that hang back?
Well, I'm the manager now, so I don't go out in the field as much. But
you said as much, so it's like you still do go,
Yeah. And as when I've swapped over to the coordinator, I've still very much get in the dirt and the grime, if you will, with one-on-ones. But I tend to stay back, try to quarterback. I've got a great team with Troy, and there's also a couple others, Amy and Andy and Mara. But we get in there. Our referral sources are 80%, if not more, 80% of emergency departments through providers, nurses, social work. If they get admitted to the hospital, we also get case management, social work referrals for people that's been admitted to the hospital for various reasons. You know?
Yeah.
So that's where our referral, but we follow up with them up to 6 months.
Okay,
So even if they discharge or, Lord forbid, AMA or whatever the situation may be, we'll call them, we'll meet them. I've literally went and got guys out of tents and sat with them and just, leveled. I've had grown men cry on my shoulder and just try to offer as much support in that moment as possible and provide resources.
Right. So, there's so many different facets of the healthcare industry, and you guys are in, one of the most, like you said, it's the crisis. You're meeting people where they are, in a day-to-day, how does it feel for you? You got to take care of your own mental health, and you're helping others. Kind of, do you guys have any rituals or things that you do to kind of help you get through some of the tougher times, or, dealing with what you deal with on a day-to-day?
So for me, when I first started, and Jonathan can attest to this, I had a really hard time because it just felt like that everybody I saw, was at their very worst. I wouldn't see any success stories yet.
Right.
So, it was really tough for me, seeing that. And a lot of times I'd walk in there and see myself laying there, which was very, very tough. And pretty quick started going to therapy.
Yeah. You need that.
a lot of prayer and, just when you finally start seeing those success stories, it really makes a difference.
Yeah.
But, mental health and substance use disorder go hand in hand. Like, almost everybody that suffers from substance use disorder has a mental health diagnosis as well. So,
right.
And the numbers are staggering. Like, Jonathan and I were talking on the way here, and he's got some too, but I just posted the other day, 525,000 men every year, 10,096 per week, 1,442 every day, and 60 men every hour. One man every 60 seconds dies by suicide. It's heartbreaking.
It's heartbreaking.
Very much so.
And, we're just out there trying to make a difference and trying to start a conversation.
Right.
This is where it all starts. You don't have to carry that around anymore.
Right. You don't have to,
Don't suffer in silence.
Exactly, yeah. If you could give some advice to someone who's maybe, listening to this podcast and either knows someone or is someone who's been fighting for a while, what would you say to them, to say, you don't have to keep doing this?
Well, there's a lot of things, and I think that depends on who you're talking to. I would like to tell them, hey, you're not alone. And whatever you're going through, we more than likely can help,
And each person affects so many others. We can beat ourselves up so much mentally.
Oh, yeah.
That if you asked yourself, is this something, what do you say to yourself every day? Is this something you would say to another person? If the answer is probably no. You'd be like, I would never say that to this person that you will say to yourself. So, in terms of success stories, is there anything, did you guys have any moments within this career to say, this is why I do this. This is why I get up every day at this point?
Oh, it's
So
almost
many.
daily.
Yeah. Daily, wow.
Yeah. We are pretty, quote unquote, we're busy. We see a lot of folks. not only does that define the prevalence of mental health, period, but for this podcast, men's mental health, but that also shows that what we're doing is working. We do follow up calls, but we get people to call us, and check in, and nobody's therapist or nothing, but I can be that accountability partner for people, and they'll call and they'll just chat and tell me how good their life has been, and success story after success story.
Right.
On the other side of that, I mean, we do still have people call with struggles, but they call. So I mean, I think that is an impact, not only Recovery Navigators, but the crisis team, Pathways. We're doing good things, I feel like, and it shows.
Right.
And I usually tell people that, the biggest step you're taking is that initial step.
Is the initial step,
and then from there, it's usually a downhill.
Yeah. And that recovery is possible. Like if you find yourself at your rock bottom, like you said, that doesn't have to be the end.
That's right. Yeah.
So in terms of these resources here in the West Tennessee area, I know you talked about all the different counties. If someone wanted to reach out from this podcast, I know, we've got the crisis and the 988 number, but is there another number they can call to reach out and just maybe get some information?
Yeah, definitely. Always welcome to call 988, like I said, but our mobile crisis number is 800-372-0693. And any questions at all, that's what we're there for.
Yeah.
Answer what we can and be that help.
Right. And I will share that number in the podcast show notes so that way we have that written down as well.
Yeah, and in order to become contacted with the Recovery Navigators, so the Jackson office is 731-541-5485. Okay. And then we also just opened up the Dyersburg, like Troy was saying earlier, the Dyersburg office number, and it is 731-287-2545. And if you call, we'll be more than glad to talk, to chat it up, as they say, and just offer as much as support and empathy as possible.
24/7, 365 too.
On call, baby.
And we've all got our cell phone numbers out there too. Like we want people to reach out however they can.
Yeah, it's that you're not a burden. People are out there and they want to help you. Yes. And I've talked to Donald Jordan, and through Pathways, the slogan is "Help is here." So that just help letting people know that. And for the fellas, you don't have to suffer in silence, like you said.
That's it.
Well, thank you guys all for coming on the show and giving us some of this great information about a program. I wouldn't say I wasn't aware of it, but you don't really know until you talk to someone in the hear the day to day and what all the services are available. All right. Thank you guys all so much for coming.
Thank you so much for having us.
Thank you.
Yes.
Thank you for listening to We Talk Health. This podcast is not intended to replace any medical advice. Nothing said in this podcast is intended to supersede or supplement the direction of your medical caretakers. If you have any questions or would like to request a topic, you can reach out to us at wetalkhealthpodcast@gmail.com.